Hi everyone, my name is Catherine Madebe and I work with the National Council of People Living with HIV, Tanzania. And for the Campus Year 7, we focus on advancing social contracting mechanism here in Tanzania.
My name is Mwajebu Mberuku, famously known as MJ, and I work with the Benjamin Mkapa Foundation. So our organization campus goal for Year 7 was basically the reduction of the HRH gap that we currently have in Tanzania.
My name is Dr. Lillian Benjamin Mwakiosi. I am from their organization, part of Campus Coalition. For Year 7, our main advocacy focus were on two main themes. First, strengthening youth leadership as part of our country's HIV response. And second, applying differentiated service delivery models to ensure that our HIV prevention programs are tailored to the needs of adolescent girls and young women who are highly affected by new infections in Tanzania.
My name is Simon Shlagwa. I'm the Executive Director of Focus for the Future Generation, the 12G youth-led organization. Looking at the Campus Year 7, of course our campaign was based on increasing the access of sexually reproductive health and HIV services to adolescents who are living and working on the streets.
Pamela from Tanzania Network for People with Drugs.
I'm Alfred, working with Research Initiative Organization. For our Year 7 Campus campaign, we mainly focus on ensuring the KVP community access healthcare services with less or minimum stigma and discrimination.
My name is Zahara Mansouri from Key and Vulnerable Population Forum.
My name is Veronica Limo and I work with National Network of Women Living with HIV.
The biggest achievements that we had first, we were able to develop community priorities, which we gathered by engaging with the PLHIV communities and develop those priorities, but also we're able to develop the resource mobilization strategy, which we also took the very two documents to present to the government, specific ITAKs, for them to know where are the needs of people living with HIV in Tanzania as far as social contracting is concerned.
The hosting and facilitation of the second National HRH Conference. And why this conference was important was because it was bringing together stakeholders all involved in HRH issues from both in country and outside the country and across Africa, I would say, and globally. And it's normally culminated with the presence of the President of the United Republic of Tanzania. So we had together stakeholders in health, particularly HRH, coming together to deliberate issues around HRH. And we were advocating for so many things, including increased work permits in the country, mainstreaming of these project-supported healthcare workers to full-time government employment system, but also the use of national volunteers to help curb the HRH gap that we currently have in country.
Through our collaborative efforts with civil society organizations and the Ministry of Health via NASHCOP and Tanzania Commission for AIDS, we were able to work together to come up with key outcomes out of Year 7 that involved expansion of HIV prevention comprehensive programs for adolescent girls and young women to cover more than 50 additional councils. And additionally, we saw more visible leadership of adolescent girls and young women through improved engagement in technical working groups and the hosting of the first ever PEFA Youth Congress in Tanzania, which brought together young people from different parts of Tanzania, different regions, to discuss practical solutions in addressing HIV infections for adolescents and youth. Additionally, on the other element of differentiated service delivery for prevention, we witnessed approval of cabotegravir, long-acting injectable pre-exposure prophylaxis, as an additional HIV prevention option for Tanzania, which is yet to be accessible, but we believe we are paving way to having it available to the communities.
One key impact of the Year 7 was now officially the adolescents and children living and working on the street are recognized to the government in terms of the service delivery, despite of the gaps that was existing from the previous time. Looking at the engagement of Global Fund, Cycle 7 from late 2023 up to early 2024, managed to include the adolescents and children living in the streets into the funding documents of the Global Fund Concept Note Development. And now currently we are looking the implementation and the rollout of the existing programs within the government, within the Global Fund, like the Timiza Malengo, that will be implemented under the PLR2, Principle of 2, the MDH. So for us, we are taking that as the win, since we advocated for the inclusion of these marginalized communities into the funding landscape within the country.
Sultan Pudi worked with several government agencies, and we have been able to scale up the harm reduction activities for the Kigamboni Mat Clinic, but also been able to scale up harm reduction programs prisons in Morogoro, Kihonda, and some of the prisons in Itega, Dodoma. And this has helped a lot of the community of poison drugs to access the services for harm reduction and the prevention of HIV services. And we learned a lot that we need to strategize a lot of plans in order to achieve all this success and all the impact to our community. So there's a need also to collaborate with government agency institution, our Compass Coalition partners, but mostly also looking ahead to see that we involve the community in each and everything.
For Campus Year 7, our main outcome was that the Cancer Health Management teams, CHMTs, in several regions such as Mwanza, Mbeya, and some part of Dar es Salaam have worked with us, Research Initiatives Organization, to create the work plan of action that will ensure the KVP individual receive friendly services from these healthcare facilities with minimal stigma and discrimination. As a result, this has impacted the lives of many KVP individuals, as now they are not afraid, they are even volunteering, being part of pioneers of healthcare facilities which are friendly to them. So KVP individuals now know there are facilities in which when they go, they will be getting services with no stigma at all.
In Y7, we were able to endorse virus prevention response. That was a milestone for us, but also we were able to rescue a fund from PEFA that helped us to implement virus prevention response and a CLM.
In Compass Africa, we have been able to do a lot in the community, most especially to women living with HIV, who are lactating mothers, and pregnant women and children who are living with HIV in Mwanza region, within 3 councils, that is Buchosa, Magu, and Ilemela. And during our implementation, we have been implementing community-led monitoring, which has brought a lot of success, and it has bring out a lot of challenges which women who are pregnant and breastfeeding are facing during accessing the services in Mwanza. And through the implementation, we have been able to reach more women at the unreached area, most especially those who are living with HIV and those who are not living with HIV. And we have been able to reach fewer men who are fishery, as well as children who are staying with their guardian or parents. And we have tried our level best to link them to the services available at the nearby facility, and that is a PEFA supported facility, and those there are others which are supported by the government. And throughout this implementation, we have achieved a lot, linking pregnant and breastfeeding women to the services, because the geographical area in Mwanza is not friendly. Most of it is surrounded by water. So we managed to access or to link them to different services which are available, most especially sexual reproductive health, GBV services which are available at the facility, as well as HIV services, that is link them to care and treatment. There are those ones who are starting the ANC, that is antenatal care and treatment clinic, and making sure that they access the services well.
As an organization, we have learned from the previous lesson that eradicating completely stigma is not a choice. Rather, reducing stigma and discrimination for this community while accessing the healthcare facilities.
Having the incredible data in the fingertips and doing advocacy adds value to the inclusion of these marginalized communities. As we see, by then we had the reports of the situational analysis that we did in 2022, having the concrete data in fingertips that helped us to advocate for the inclusion of these marginalized communities within the funding landscape of the Global Fund within the country. We are happy to see now the implementation of and rollout of the PLR2. And of course, looking at that angle, we had the engagement of like now the review of the standard operation manual that was guiding the implementation of HUI being reviewed to include adolescents, boys and young men, so that comprehensively being adolescents and young people standard operation manual that includes the adolescents, girls and young women, as well as adolescent boys and young men who are living and working on the streets.
The biggest lesson has been working in partnership with different stakeholders, because I know sometimes we're working in isolation, but we're able to pull out the impact that we had for the year 7, and which also accelerate more outcome for the year 8 through partnership and collaboration with, especially with the government stakeholders, but also other CSOs and private sector specifically. So how we've been able to achieve all that, it was because through partnership and potential collaboration that we were able to have with different partners and stakeholders, for them to also own social contracting as one of their agenda, and one of the things that they can actually advocate, one of the things that we can actually work together to ensure that it is introduced here in Tanzania. Looking forward to greater impact on the strategies and lessons that we have been able to learn. I think for us, we have taken that lesson very highly, especially in terms of partnership and collaboration, and that is what is the thing that we are doing actually here in this year advocacy, in our advocacy campaign. And I would advise everyone in terms of who is working on Compass, who's working in advocacy, partnership and collaboration is always bring greater impact. It's better moving together than moving alone.